Thank you for your interest in palliative care for Parkinson's disease, putting you and your family at the center of care. And hopefully, by the end of this talk, you'll see that palliative care really is about living well now. When we talk about palliative care, people often think about the end of life, but really, what we're talking about is a philosophy of care where we put you and your family at the center of our attention. We're interested in your goals, your values, and your personal style. And in this talk, we're going to go over some of the symptoms that can be burdensome for our patients. What is palliative care, and is it for me? And something that your palliative care team can help you articulate and formalize, which are your advanced care directives, and really why you should have them. When we think about Parkinson's disease, many people just think about shaking. But of course, it's so much more than that, and many of you know that and are living with it. It involves your sense of smell, your sleep cycle. It can involve your mood, as well as your autonomic functions, so control of your bladder and bowels, as well as your blood pressure. And so when you go to your movement disorder neurologist appointment, you will be faced with a medication review, your blood pressure checked, non-motor symptoms being questioned, as well as your motor examination, and a cognitive assessment of some sort. And so you think, what else is left? Well, there's a lot left, and a lot of it is about you. So what can palliative care provide? It really provides relief from pain and other distressing symptoms, integrates psychological and spiritual aspects of care, offers support to the family so that they can cope, uses a team approach to address needs, and will enhance quality of life and may therefore positively influence the course of illness, is applicable early in the course of illness, and affirms life, but also regards dying as part of the normal process. And who is part of the team? The neuropalliative care team is really an emerging concept in many countries. It's provided by geriatricians. And in my team, it involves a neurologist, a palliative care physician, a nurse, and a spiritual care psychologist. And we also send our patients to many other resources and team members who are familiar with Parkinson's disease. So you can see that really supporting you is important, and it can't rely on just a single person or a single discipline. It involves a team. And when we talk about palliative care, we are talking about determining what are your goals, what is important to you, and what brings you joy, and how is your care partner managing. We also use different scales. So this is one of them. It's the Edmonton Symptom Assessment System, which is modified for people with Parkinson's disease and asks questions about stiffness, constipation, swallowing, and thinking, in addition to typical palliative care symptoms like pain, fatigue, depression and anxiety, shortness of breath. And it's surprising how many of our patients with Parkinson's actually have these problems, and we haven't really been dealing with them. We also involve the family because your care partner or caregiver are important members of your care team, and we often don't recognize that in medicine. And yet they have such important observations, they have an important role to play, and they are your primary support. We also know that when the care partner does better, the person with Parkinson's disease generally does better. And we also know that when someone does not have an engaged care partner, really they do poorly even if they don't have very advanced symptoms. So there's something about having a primary person on whom you can rely that really improves someone's quality of life. And that's what we're talking about in palliative care. Not a score, but your quality of life. We also recognize the importance of spiritual care. Frequently people say, oh, I'm not religious, or I already have a church or synagogue or shrine that I belong to. But it is about connection, having meaning and purpose in life, as well as finding peace and transcendence, our ability to connect. And spiritual care often involves helping people when something happens that really shakes your faith in the logic of the world. Why has this happened to me? I'm sure many of you asked yourself that question when you got the diagnosis of Parkinson's. How can I go on? And how can I find meaning in life? And this is why spiritual care, in my opinion, is an essential part of palliative care, because the spiritual care provider can help guide you so that you can see the meaning that is present in your life and again reclaim your joy. I discuss goals of care or advanced directives, and this is something that your palliative care team can help you formalize because we are used to guiding these conversations. And some people get scared when they talk about their goals of care because they have this superstitious belief, well, if I talk about it, it's going to happen. But if you don't talk about it, how will your family know? So people do think it's important to talk about it, but less than 30% have done so. 60% don't want their family burdened by tough decisions for them. But almost the same amount have not actually talked to their family about it. 80% want to talk to their doctor about their end-of-life wishes, but 7% have actually done so. And 82% think it's important to have their end-of-life wishes in writing, but 23% have actually done it. And so your palliative care team can help you. And here are some of the other tools that can also help, because it's not about technology. It's really about what is important to you. What makes life worth living? What would be an acceptable quality of life? And answering those questions are probably more important than a number or a letter or circling something on the page. And that narrative is very important to me as a physician. And I think it's very meaningful to my patients to have helped them articulate that. You can also use these tools, 5wishes.org and the Go Wish app from the CODA Alliance.org, your country or state's advanced directive forms, since these are often legally recognized. But I would ask you to share them with your family, but also your physicians. And I suggest you keep a copy of your goals of care on your phone. And so I hope through this you've seen that palliative care is really not just for those who are imminently dying, but it can help you throughout your course of Parkinson's disease. And if you are fortunate enough to have a neuropalliative care team in your city or in your area, I would encourage you to use their services because we can help you live better now. Thank you.